talking. 938 Live gets you talking with The Breakfast Club.
This edition of The Breakfast Club is brought to you by Active Global, Specialised Caregivers, professional, affordable home care. Now, as our population ages, many of our silver generation will begin, of course, to need more specialised care, especially if they have a particular health condition or several. By 2020, Singapore is expected to have almost 53,000 people living with dementia. That number, of course, is expected to rise up to about 187,000 by the year 2050.
So if you're looking for highly trained, specialized caregivers for your loved one who may be living with dementia, then Active Global's foreign-trained nurses could provide the dedicated care that is needed for them. Now, Active Global's caregivers are foreign-trained nurses who have significant hospital training and relevant elder care experience. Now, joining us again this morning are Rosnah Adam. She's a Singapore-registered nurse with 25 years of experience, and she is the caregiving consultant with Active Global. And Jith Joseph is the Business Development Manager from Active Global. Of course, thank you very much once again for both of you joining us.
Thank you. Good morning, everyone.
Now, Rosnah, let me start with you. Give us an idea of what dementia is all about, really.
Okay, dementia is a general term for a decline in the mental ability severe enough to interfere with daily life. It is caused by physical changes in the brain. Memory loss is an example. One of the most common is Alzheimer's disease. Is one of the type of dementia, apart from other, because it's about 60 to 7% of dementia cases are Alzheimer's disease.
Could you perhaps also expand just a little on the remaining 30%, 30 to 40%?
So it's usually like Parkinson's disease, Hutchinson disease, so it's all different types of
whatever
disease.
Affects your
Brain
neurological
connection, yes,
state,
correct.
right? Let's talk about the manifestations. I think we're all more or less familiar with what could happen. You forget things, you might leave the house unsupervised and find yourself in a place that you don't recognize, don't remember where you live. We've all heard stories like that. What are some of the more specific manifestations, other specific manifestations that a caregiver would have to deal with?
Okay, usually the main thing what you just said is forgetfulness. You know, they forget everything. That's where it can be a short-term kind of thing when it started off, and it can just continue that way. And then a part of that, they also have judgments, decline in others' thinking skills like judgment, language, ability to focus and pay attention, problem-solving abilities. They also affects and reduce a person's ability to perform activities of the daily living. They can't even do a simple buttoning of their clothes, you know?
Yeah.
So all those things affects themselves, and then behavioral changes, feeling suspicious, depressed, even because they forget who you are.
They don't recognize their own family.
Recognize their own family. So when they
suspicion.
see, so they get suspicions. Are you trying to hurt me? That kind of thing.
Right, okay.
So that's where when the progressioners is there, so they get to be very violent, because every little thing to them is
a threat.
A threat to them. Yes, correct.
Yeah.
So that's where the violence comes in. Yeah.
Of course, dementia is a progressive disease, I understand. Yeah. How exactly can a person, a relative or a friend, recognize the early signs of it?
Okay, usually we don't. Because the early signs, we would think that it's just, okay, we forget to close the door. You know, maybe it's just because we forget. You know, we didn't realize that actually it's setting in already.
Right.
Yeah. So.
Oh dear. Okay, I
correct.
forget things, from time to time. But I know what you mean. I mean, let's not make light of this.
Yeah,
some of it is just genuine, general,
correct.
harmless forgetfulness, which is why it can go undetected.
Yeah. So we always think that then somebody would just say, "Hey, you forgot to close the door." So we think, "Oh, okay." My mind is not, not there.
Today,
I'm just thinking of something else. The kind of excuses that we give, but actually along the way, as they go on, the forgetfulness will be more severe. In that it can also endanger themselves. Like they forgot to off the stove.
Yeah.
Is endangering one's life also.
We mentioned earlier that the number of people with dementia is expected to hit 53,000 by the year 2020, more than 187,000 by the year 2050. How many people live with dementia currently in Singapore?
I think in Singapore we're seeing about 25,000 people who are suffering from dementia or dementia-like symptoms. But it's just not Singapore. I mean, in our other Asian offices in Hong Kong and Shanghai, we are seeing the same trends. There is a huge increase for demand for services to support people with dementia. And they form one of our main large percent of our clientele.
What is the age range usually of people who begin to suffer from dementia?
It depends. It's usually around after 40 plus, 50 plus.
Really?
Yeah.
That early. I thought that would be
yeah.
classified as early onset,
It
wouldn't
all
it?
depends, yeah. It's the early onset set because the forgetfulness started off very early. So we always forget that they are actually, starting off with having dementia already. Yeah.
And it might get more severe once you hit your 50s,
once-
60s.
Yeah, then they will, they tend to really forget everything. They can't even do simple things as eating, drinking on their own kind of thing. So that's where the caregivers will come in to help them. with
Are there
all the
ways to
activities.
clinically diagnose dementia,
there will
even at
be.
the early stages?
The doctors will do the diagnosis. They have some diagnosis tests that they will do with them to check whether it's really just an onset of dementia. It's just a normal
Forgetfulness that happens to
Yes,
everyone
correct.
from time
It's
to
true.
time. So even at the early stages, you can get diagnosed for dementia for sure.
But it can be missed.
It can be missed.
It can be missed.
Okay. But always take the precautions that you feel comfortable taking, I guess. If you feel you want to get diagnosed early, just take a look,
Yeah.
Caregivers, I think they are very important figures in a person's life if they have dementia or any related diseases. To what extent do you find family members actually want to try to look after their own relatives with dementia?
Since dementia is a very progressive disease, it gets progressively much more difficult to look after someone with dementia. And I think a lot of family members take on that responsibility to look after their loved ones as much as possible. But as the disease progresses and the conditions deteriorate, I think this is where a professional caregiver can come in to help them manage the symptoms and help alleviate the stress levels associated with caring for a person with dementia. And I think if you specifically look at what some of our professional caregivers do, they address the patient-specific conditions. And dementia is not the same for everyone. There could be certain conditions that are very specific to that person. So our caregivers work on connecting and communicating with the patient. They encourage activities with the patient. They also support them in personal care, for example. So as Rosnah mentioned earlier, if you forget how to put on a button of your shirt,
Right.
our caregivers help identify and build on the skills, and also help them support during their eating, drinking, and general activities. We also help them prevent falls, even helping them from wandering off, keeping a lookout for them.
Yeah.
Which can be quite scary because they are very unaware of the situation. They might be worried or stressed.
Yeah.
And we do have cases of old folks in Singapore just wandering off, and on a regular basis you can see people putting it up on Facebook. They look out for my mother. Or
Correct.
Yeah.
And because they look so normal, and they're not maimed in any sort of form, so people just take it for granted that this
it is-
person is okay.
It's okay, and they might be part of being old.
Yeah,
which is
yeah.
also not correct. Recent studies have shown that professional caregiving or the right form of caregiving has shown efficacy in managing the progression of cognitive decline.
It can slow down the cognitive decline?
Yes,
okay.
Yeah.
It can't completely cure, but it can
Of
slow
course.
down.
How does it really help, though? I mean, is it a question of encouraging activities
Yes.
with the patient? Is that what really helps slow down the progression?
I have a case whereby this client of mine, she has a dementia, and what the husbands used to do is just to every day without fail will look through the photo albums for the family. So when you come over, you just ask her, who is this? And she can recall, that is something nice to hear, that she can still recall her family members. So that's why we always encourage our caregivers also to build up a family tree for them. So to put it on the wall in the room, so at least when they will know who is coming. We can tell them, okay, today your son is coming. You know which son is coming to see you, so they will show you in the photo. Okay, this son is coming to. They will tell you, identify this person. So it's at least helping them. All these little things to us is nothing, but to them is very, very important because they have this problem in them that we need to instill that, okay, this is who. So it makes them
Talk
feel
to
happy.
them,
talk to
remind them of
correct.
what their
Even
lives are
playing
about.
cards with them. Cards is very simple. The cards have numbers and colors. So just telling them this is the color that, okay, how many colors are there, so at least they can inform you, okay, the cards have how many colors, and then what is the numbers. Just letting them stack number 4 together, so it helps them. So they have to count what is the numbers. So it's just helping them. It's just like what we say, going back to childhood time. Right, we need to teach a child how to do all these things again. So it's the same thing. Just to remember.
I know that your caregivers do a very comprehensive job, but to what extent do you also help train, so to speak, the family members in order to be able to engage with the dementia patient and to care for the dementia patient also sometimes on their own? Because it's also a bonding exercise, isn't it? The family still has to stay involved in spite of the fact that they have a professional caregiver in the home doing the major work.
I think the professional caregiver plays a part, of course, in the caregiving. But like you pointed out,
major
the family
role
has to be involved in that care process.
Sure.
If the caregiver is recommending a certain routine actions to be taken, the family has to be part of that routine care to help the patient, build a better bond or remember their self in the family. And I think this is where the caregiver can come in to help, take away the stress of managing some of the very stressful episodes that a dementia patient might have, but also involve the family in that caregiving process for the long term.
Is the caregiver qualified to make case notes and report so that when the patient goes for his or her checkups, those case notes are studied?
Yes, they do, because they have this what we call the holistic care plans that we give to them. So what they do is they will jot down whatever information that they need and whatever changes that the patient make during their visits, so that they can inform the patient, the doctors and the nurses, because our caregivers will work very closely with the doctors and nurses for the well-being of the patient itself.
For sure. These are professionally trained nurses as well.
Let's talk about your caregivers. Who are they really? And tell us more about how much the service costs too, because I know that cost tends to be quite an issue for people in general.
Well, as you pointed out, these are professional trained nurses with a minimum of 2 years of experience. They are foreign trained nurses. They are currently here in Singapore under the foreign domestic worker visa, and they live with the families at home, providing full-time home care. Their salary ranges anywhere between $600 to $1,000, and it depends on their expertise and skills. We, on our part, make sure that the caregiver that is matched to the family has the right set of skills that are needed to take care of that specific patient. And we do this with an individual assessment of each family and each patient before they engage one of our caregivers.
I understand there's a worldwide shortage of healthcare workers, though. So how do you attract qualified and motivated nurses to Singapore?
I think there is our ethical hiring practice is what gives us a huge advantage in hiring some of these caregivers. I think in Asia, as all of you might know, there is a very unfortunate practice of getting these people to pay 6 to 8 months of their salary to get a 2-year contract. We think this practice is unethical and totally counterproductive to attracting good quality talent to Singapore. So by being the only one who recruits directly from these countries without them having to pay any money up front,
no middleman involved, none of those things.
None of these things. We are able to get really great candidates who are really motivated to be caregivers and not worry about a debt that they might be having to service.
And so, indeed, for somebody who really wants to, get a specialized caregiver, how do they go about doing that?
Well, it's simple. All you have to do is just give us a call at our number, which is 6536-0086. And one of our caregiving consultants, like Rosnah herself, will come to your house to do a very free assessment, or even at your home, or even if your family or member is in the hospital. This is totally free. This helps us to assess your situation. And
the first assessment is free.
Absolutely. Yes. Which we think is important for them to identify whether our caregivers are the right fit for the family. Or you can even visit our website, which is www.activeglobalcaregiver.sg.
Thank you very much, both of you, for joining us today. Rosnah Adam, a Singapore-registered nurse. She's got 25 years of experience, and she is the caregiving consultant with Active Global. And Jith Joseph, business development manager at Active Global. Once again, the phone number is 6536-0086. The website address, activeglobalcaregiver.sg.
And this edition of The Breakfast Club is brought to you by Active Global, Specialised Caregivers, Professional, Affordable Home Care.
938 Live. 938 Live gets you talking.